from person to person through sexual contact. There are about 20 different microorganisms that are known to be transmissible by intimate sexual contact, and they are responsible for spreading about 50 different diseases. And FYI, sexual contact is more than just vaginal intercourse. It also includes penis or vulva to mouth, which is oral sex, penis to anus, which is anal sex, and any sexual touch that involves touching genitals. Any one of these activities can put a person at risk for an STI. STIs spread through contact with semen, vaginal fluids, and in some cases blood or skin-to-skin contact. For an infection to occur, a person must engage in sexual activity that involves direct genital contact or the exchange of semen or other body fluids with someone infected with an STI. So why is it important to learn about STIs in the first place? Well, it helps one to be able to take care of one's own body, and untreated STIs jeopardize a person's health. It also helps a person to be able to discuss STIs with a sexual partner. Did you know that 20 million people are diagnosed with an STI each year, half of which are 15 to 24-year-olds? And most of those cases are the HPV virus. Lastly, each year the U.S. healthcare system spends about $15.6 billion on the treatment of STIs alone. So what are the most common STIs in the world? The 6 most common STIs worldwide include the HPV virus, chlamydia, genital herpes, gonorrhea, trichomoniasis, and syphilis. The good news is, STIs are preventable. The surest way to avoid an STI is to practice abstinence, aka don't have sex. Other ways we can protect ourselves from STIs include using condoms, a dental dam during oral sex, getting vaccinated, communicating with a sexual partner, reducing risk behaviors that would increase our likelihood of contracting an STI, like having unprotected sex or sharing dirty needles, getting tested and treated, and reducing the number of sexual partners that we have. While there are many different STIs, symptoms of STIs are more or less the same, which can make it difficult to know which STI a person may have based on symptoms alone. It is easier to have an idea of STI symptoms instead. Symptoms of STIs include a rash, bump, sores, or blisters around the penis, vagina, mouth, or rectum, painful urination, unusual drips or smells from the penis or vagina, an itchy penis, vagina, or rectum, and bleeding or pain during sex or urination. If a person notices any of these symptoms, they should get tested right away. However, many of these are asymptomatic. This means that they don't show any symptoms. This is why it's so important to get tested anytime a person has a new sexual partner, even if they don't have symptoms. So there are 3 categories that STIs fall under, and the category they are in depends on the pathogen that causes them. There are either bacterial STIs, viral STIs, or parasitic STIs. Bacteria STIs can be cured and include chlamydia, gonorrhea, and syphilis. Viral STIs do not have a cure. Rather, when someone contracts a viral STI, they have it for the entirety of their life. Treatment focuses on managing symptoms and preventing the spread. Viral STIs include the 4 H's: HPV, which can cause genital warts, HIV, herpes, and hepatitis B. Lastly, the parasitic STIs can be cured, and they can be transferred through sexual contact or sharing bed sheets or underwear. This includes the STIs pubic lice, scabies, and trichomoniasis. As I just mentioned, while some STIs can be cured, many of them are permanent, and some of them are fatal. The curable STIs include bacterial and parasitic STIs. So these STIs are caused by bacteria and can be cured with antibiotics. Chlamydia is the most common STI among teenagers. Most people, about 70%, experience no symptoms. If left untreated, chlamydia can cause pelvic inflammatory disease, or PID, which can lead to infertility. PID is actually a really painful disease that you can see in that picture there. The fallopian tube has become so infected, it has swollen, and it actually becomes completely blocked with scar tissue, which causes the infertility. Gonorrhea is the second most commonly reported infectious disease in the United States. It is also more commonly known as the clap or the drip. Most infected people show no symptoms with gonorrhea, and if left untreated, it is the major cause of PID and can lead to permanent sterility in males and females. Syphilis occurs in stages. Depending on the stage, there may or may not be symptoms present. Though syphilis is curable, if it is left untreated, there can be many long-term consequences that are irreversible. The primary stage of syphilis is usually marked by a single painless sore called a chancre. The sore will go away with or without treatment, but without it, the disease will progress. The secondary stage of syphilis includes a skin rash and mucous membrane lesions. Flu-like symptoms may appear at this stage, and again, those symptoms will resolve with or without treatment, but without treatment, the disease will continue to progress. The third, or latent stage of syphilis begins when the secondary symptoms disappear. It can damage the internal organs, including the brain, nerves, eyes, heart, blood vessels, liver, bones, and joints, and cause long-term effects like heart damage, nerve damage, numbness, dementia, gradual blindness, paralysis, and brain damage. These STIs are caused by parasites and can be cured with antibiotics. Pubic lice, more famously known as crabs, are tiny bugs less than 2 millimeters long that live in pubic hair. They're commonly known as crabs because the parasite that causes them looks like a crab. Pubic lice is not a major health hazard, but can cause extreme discomfort, including extreme genital itchiness. Generally spread through intimate contact, however, pubic lice is possible to be spread from clothing, bedding, or towels. Scabies is the infestation of the skin by the human itch mite, which burrow into the upper layer of the skin where they live and lay their eggs. Generally spread through intimate contact, but scabies can also be spread through direct, prolonged skin-to-skin contact. Scabies is treated with a product called a scabicide, which is a cream or a lotion prescribed by a doctor. And lastly, trichomoniasis is an infection caused by tiny parasites. Often there are no symptoms with trichomoniasis, and it is mainly transmitted through sex, but can also be transmitted through contact with damp clothing or towels. Trichomoniasis is treated with a megadose of antibiotics, that's 1 pill of a super strong antibiotic, and if left untreated, it can cause complications during pregnancy. The rest of the STIs we will talk about are incurable. So once a person contracts them, they will have them for life. HPV, the human papillomavirus, is the virus that causes genital warts. HPV can also cause cervical, anal, or throat cancer depending on how it was contracted. Think about that one. There are usually no symptoms of HPV. If there are symptoms, warts may appear weeks or months after having sex with an infected partner. Cancer-causing HPV will not show any symptoms until the cancer is advanced. While there is no cure for HPV, warts can be treated and removed. There is also now a vaccine for the most aggressive strains of HPV called Gardasil. It can be administered to persons ages 9 to 26. Herpes is caused by the herpes simplex virus, or HSV. HSV is the same virus that causes cold sores, though it is a different strain. However, it is possible for HSV1 the cold sore strain, or HSV2, the genital herpes strain, to occur either on the mouth or the genitals, depending on how it was transmitted. Only about 1/3 of cases develop outbreaks or sores, and antiviral medications can help prevent or shorten the outbreaks. HIV is the virus that causes AIDS. HIV can spread through sexual activity or contact with contaminated blood. It can also be passed from mother to child through pregnancy or breastfeeding. HIV attacks the body's immune system by destroying lymphocytes, or white blood cells that fight pathogens. As more cells are destroyed, the immune system becomes weaker and weaker. Many people infected with HIV do not have any symptoms. Symptoms don't usually develop until the person's immune system has been weakened. Symptoms, when they do show them, would include swollen lymph glands in the neck, underarm, or groin, recurrent fever, rapid weight loss for no apparent reason, constant fatigue, decreased appetite or diarrhea, and white spots or unusual blemishes in the mouth. While there is currently no cure for HIV, early diagnosis and antiretroviral medications can slow the progression of HIV and delay the onset of AIDS. In fact, our medications today are so good that a person could live an entirely normal lifespan without ever progressing to the AIDS stage. Hepatitis B is a liver disease that results from infection with the hepatitis B virus. The virus is passed from person to person through blood, semen, or other body fluids, and is treated with antiviral medications to slow the virus's ability to damage the liver. However, if untreated, hepatitis can cause cirrhosis or permanent scarring of the liver, liver cancer, or liver failure. A person can make good choices so they don't get an STI. So, what can a person do? They can, 1, not have sex. They can use condoms or a dental dam. They can choose their partners wisely, and they can get tested regularly if they are sexually active. Using condoms each and every time a person has sex greatly reduces the risk of contracting an STI. And remember, sex is a big responsibility. If a person is not prepared to, talk to their partner about their sexual history and STI status, get tested for STIs when necessary, talk to their partner about using condoms, and use a condom. They probably aren't ready to have sex.